Hello everyone. This video will have a series of cases of the postmenopausal bleeding with endometrial hyperplasia followed by the hysteroscopy. Well, this is the complete evidence of the endometrial hyperplasia suggesting for the endometrial carcinoma. A thick endometrium, irregular endometrium with endometrial collection, which are very suggestive for the endometrial carcinoma. Look at how the subendometrial junction or the halo is also obliterated and mild vascularity is also found. So these all features are the suggestive for the endometrial carcinoma. One, the thickened endometrium, and second, the irregular endometrium. Third, with the endometrial collection. So this is in the endometrium. This is the right tract. This is the lower side is the false tract, and this black halo is the right tract. So entering to the endometrial cavity, well, this is a big cavity. That's why it's difficult always to put the hysteroscope and get the proper distension. And this is how the cavity is distended, and this is the polypoid growth is present, and a targeted biopsy should be taken from that mass, and it must be subjected for the biopsy ideally. And if the hysteroscopy is not available, we can go for the DNC and biopsy also. This is another case of the endometrial hyperplasia of around you can say more than 15 mm. So this is also a bit irregular, but this is the hysteroscopic finding. This is also a case of postmenopausal bleeding of 56 years. And these are the two polypoidal growth present in the one in the anterior wall, and second one is in the posterior wall. Here you can pick up this polypoid growth, and we can subject them for the biopsy. If anything wrong or the carcinomatous or the malignancy comes, then further treatment is there, or else the treatment is only the polypectomy will suffice. However, presence of polyp in the postmenopausal lady is also very much suggestive for the malignancy. This is another case having very thickened endometrium with some irregularities there, and we must assess it. This is the transvaginal scan, and we must assess in detail the thickness of the endometrium, the irregularity, the regular margin of the endometrium, the subendometrial halo. These are few things that we must assess in the ultrasonography, particularly in a case of postmenopausal bleeding. And this is the hysteroscopic picture. Look at this picture speaks a volume that this is a case of malignancy. Presence of neovascularizations, dilated vessels with friable mass all throughout the cavity. This signifies that there is definitely this is an endometrial carcinoma, and the biopsy should be taken or the subjected for the biopsy. This is another case that this is again the thickened endometrium with endometrial collection, and this again suggests that unless and until it is disproved, it is a case of cancer endometrium. That should be always borne in the mind, and it should be. So this is again followed by the hysteroscopy. Look at this is again friable mass with dilated vessels and neovascularization. These are friable growth, and it must be subjected for the biopsy. A targeted biopsy with the hysteroscopy is very welcome. Or else, if it is not available, we can go for the endometrial biopsy with the curette. So this is how the curette material is taken and squeezed so that the blood will be out, and this endometrium can be assessed in naked eye. Look at how the endometrium is friable, and there are plenty of endometriums, so it suggests that it might be a case of endometrial carcinoma. This is another case of postmenopausal bleeding. Of course, she was 54 years. And look at the assessment of the endometrium. Definitely, the endometrium is thick, but there is something in the same equipattern mass is also present in the anterior wall, but it is well circumscribed. And the hysteroscopic assessment, this is the hysteroscopic assessment, and in the right lateral wall there is a polypoid growth, and it is very suggestive that this is a case of myoma, submucous myoma type 1 type. And here the treatment, we can go for the TCRM or the transcervical resection of the myoma, and we can also subject the endometrium for the HP study. Of course, if the endometrium is okay, then we can leave the patient for the follow-up. So these are the cases that I presented, that postmenopausal bleeding with endometrial hyperplasia, that it must be evaluated properly, and the endometrium must be subjected for the biopsy before going for the final operation. Thank you very much for watching this video. Thank you all.